This show is produced by the Hartman Media Company. For more information and links to all our great podcasts, visit hartmanmedia.com.
Welcome to the Longevity Show, informing listeners on the important aspects of health, wealth, and happiness to ensure you live life to its fullest. With fascinating interviews with top authors and gurus in the field, along with the latest news in the science and technology of longevity, we're going to reveal expert advice and amazing secrets of living a longer, happier life. And now, here's your host, Jason Hartman.
It's my pleasure to welcome Dr. Stephen Hotze. He is founder and CEO of the Hotze Health and Wellness Center, president of the American Academy of Biologically Identical Hormone Therapy, best-selling author of 2 books, including one that we'll touch on a little bit today, Hormones, Health, and Happiness, a natural medical formula for rediscovering youth with bioidentical hormones. But of course, we are going to talk about current events extensively. Stephen, welcome. How are you?
Jason, I'm doing fine. Greetings to you from Houston, Texas.
It's good to have you on. So you have something of a contrarian view, you say, as to what's going on in the mainstream media, and we would love to hear more about that. So tell us more.
Well, the mainstream media, the government, health, bureaucrats, and the politicians have created irrational fear, mass hysteria, and panic surrounding a virus, the coronavirus. This is not a new virus in the sense of that coronaviruses have never existed before. Most people have never heard the name, though, because some of the other coronavirus diseases that have been experienced in the world in the last 20 years were not called coronaviruses. They were called the SARS virus, which was back in 2002, 2004. That was severe acute respiratory syndrome. That was a coronavirus. The MERS, the Middle East respiratory syndrome, 212 to 214, that was a coronavirus. Common colds, one of the causes is coronaviruses. So coronaviruses have probably been around since the beginning of mankind, but they were discovered in the 60s, and there are numerous coronaviruses, and it's like numerous viruses of the influenza viruses and other viruses, and it causes respiratory illnesses, just like the influenza virus does. So if we didn't have a name for it, if they hadn't blown it out of proportion, people might say, well, it's the Wuhan flu, because it produces the same exact symptoms as a flu. It'd be considered a flu bug, a flu virus of sorts, just a corona instead of influenza. So the media has blown this out of proportion. Let me tell you why I know it's blown out of proportion. The first time I heard about it was in January of this year. I opened up my Wall Street Journal. Front page cover was 300 people have the coronavirus in China and 3 have died. Why would that be front page news in the Wall Street Journal? There was a long article on it. Mm-hmm. Well, I know that same day, 1,800 children had died of diarrhea around the world. And 1,800 people had died of heart attacks that day. What was so special about 3 people with the coronavirus in China? Well, somebody had, in my opinion, this was all well planned out, thought out in advance. And I'm not sure who did it, who has the ability to do it, but I do know there were 1 million people in the streets of Hong Kong a month before in November, demonstrating against the communists. And guess what?
An interesting way to keep them quiet and get them back at home, right? Yeah.
Put all those, they're not demonstrating in the streets in Hong Kong.
Yep, not anymore.
So anyway, so it comes over here and the media goes absolutely crazy about it and causes the public to panic. And so I started to run the numbers. One thing I learned from my mother when I grew up, and she helped me become a contrarian, she said, never follow the herd. When you follow the herd, you're always going to get stampeded or run off a cliff. Turn around and lead the herd. So when I've never seen panic like this. I've seen people think wrongly, and I've thought contrarian. There was no question in my mind that this was totally crazy because everybody was crazy. They were what we call, there's an old expression, bat crazy. Just like there's another word for BS.
I think we caught the idea. Yes. Go ahead.
That's why I use the term. So what I say to this is Bolshevik. And I heard that on a New Orleans radio program this morning. Instead of saying BS the other way, they said Bolshevik.
Got it.
Which was a nice way to say it.
But
so anyway.
Yeah, tell us what.
Let me finish this. Okay, so Here we have in America, maybe upwards right now of 25,000 people have died. How many people? I had a list here, 300,000 or 500,000 have had the coronavirus. And I want to say, so what? 600,000, according to CDC, and 25,000 have had the disease. So what? This year, the CDC reports that 54 million people in the United States have had the flu. That's 1 out of 6, as opposed to 1 out of 1,000 who've had the coronavirus. Upwards of 62,000 people have died of the flu in the U.S. since October 1st. That's 344 every day since October the 1st. We didn't quarantine. And this isn't the only year it happens. Every year, on an average, about 50,000 Americans die of the flu. We don't quarantine. We don't shut down the churches. We don't close businesses. We don't social distance. Everybody moves on.
Got it.
We live with it. That's just part of life.
Okay.
So why all of a sudden? The coronavirus?
Can I ask a question about this? Okay. So look, I've heard that argument, and I've thought that argument myself in the beginning of this. Now, is it fair to say that there are some differences? I know that the numbers are higher on the flu. They're higher on a whole lot of things. I mean, if you want to talk about a high death rate, just look at abortion. That's a massive number.
Right.
Okay. But hang on. Okay. The R0 factor is higher on coronavirus, and it has different characteristics. Okay, I mean, with the flu, you only infect like 1.7 other people or something like that. With this, they don't know, but they think it's between 4 and 6. And when you do the math on that, exponentially, it's hugely significant, that seemingly small difference, right? With the infection factor, the contagion factor, the R0 factor. So, that's one
Jason,
element, and there are others.
The R0
factor, go ahead. Yeah.
On the R0 factor I've seen is like 2.3.
Okay.
But if it's
debatable. People
if it spreads. So look, just go look at the records in South Korea and look at Singapore, look at anywhere else. There's no evidence at all that that's really correct. It's been here 3 months. Why hasn't it spread to more people? Why aren't more people sick?
Well, I mean, the folks would argue that we did the lockdowns and we took measures and.
Sir, they didn't do any lockdown in South Korea. Didn't do a lockdown in Singapore. And they're not doing it in Sweden. And the numbers are better in Singapore and the South Korea than here, and not just slightly worse in Sweden.
And Sweden's trying to get herd immunity, so they have a totally different philosophy, which might be the right one. I don't know, but
that is the right philosophy. Right, okay, that is exactly.
Tell us about herd immunity a little bit. Explain to our listeners what that is and why it's the right way.
This is not rocket science. This is the way mankind has operated since the beginning of time. Mm-hmm. In fact, there are tribes today. When somebody gets sick, everybody gathers around the sick person to make sure everybody gets it, they get herd immunity.
When I was a kid, we used to have chickenpox parties. Parents would put their kids together. Yeah, right. Yeah.
Hello, and measles party. That's the way that it was done. So here's the way it works. Okay, so we have a new virus that comes over, and it's a coronavirus. So it's got different characteristics, not the same exact virus as the flu, but the flu strain is different every year. That's why the flu shots are not effective, because you're taking a flu vaccine from a flu that exists when you make the vaccine, but you've got a mutated a virus 6 or 8 months later. So it's just in the flu, 50% of the people that get the flu had a flu vaccine and it didn't work.
Okay, so tell us more. So
virus causes the most problems with who? The elderly, the infirm, the debilitated, those with pre-existing condition, congestive heart failure. They've been smoking. They got emphysema. They have diabetes. Okay. And there's some other coexisting conditions. Well, why don't we just seclude those people? Seclude yourself like you would during the flu season. Don't get around crowds. 90% of the people would have no problem whatsoever, and they'd get over it in a week and they'd be done. Well, this is what you ought to do instead of dragging this thing out. By pushing they want to push everything down and lower the curve so it's more flat, and that's going to go on for how long? They're talking about a year, 2 years. I say Bolshevik on that. Let's put all the good, healthy people back to work, back to school, back to church, greet each other, shake hands, hug, be close together. Let this virus run its course in society. Boom, get it over with. And then that's the way you're going to protect all the other people who are secluded, because they're not going to have a reservoir or host. The virus will be gone. It'll be over. Otherwise, if you don't let everybody come in contact with it, you're not going to have herd immunity. And we're going to be living with this over the next 12 months, 18 months, until we get a vaccine. Oh, what's that about? Well, who's pushing the vaccine? Bill Gates.
Yeah.
Go look up who.
Right.
Go look up who Bill Gates invests with.
Yep.
And guess who?
Bill Gates, like
guess
everybody, has his agenda too. Don't consider him some kind of saint. He's got an agenda just like everybody else.
Sure, he does.
Yeah,
does.
right.
You bet he does.
Yeah. Right.
So that's the situation. So what I'm saying, and look, and the other thing you haven't heard, the conventional doctors and Fuzzy Fauci. I call him Fuzzy Fauci, and I think he's a twerp, and I just mean that because I think the guy's as goofy as a bedbug. He says, we're not going to ever shake hands again. Really? Well, you may not. I'm not sure I want to shake your hand, sir, because I sure don't appreciate what you've done to the country and how you have tried to lock everybody down. Listen, I saw today another 6.5 million people that had applied for unemployment. And so now that pushes it to 23 million. The feds in St. Louis say it's going to go to 47 million, 32% unemployment. What kind of public health adverse consequences is that going to have, sir? Yeah. Poor people don't do well. They're not healthy people. So you've got to look at the cost, risk, benefit. Okay, think of it like this. This is the course of life. People are born. Nobody said today how many, and I ought to look it up. I should have had this. How many people were born today? How many people were born? Well, probably thousands and thousands. Nobody says, boy, look at all the new life. Well, no, we had some old timers that died. Now, I'm sorry that these people have died, and I want to protect them and seclude them and all that. But the people that, a large proportion of the people that die are in nursing homes. How many people come out of nursing homes alive? Let me ask you that. Why do they get put in nursing homes? That's the last portion of their life. They go there, and they're at the end of their life, and they usually die of some form of infection is what they do. That's what happens. And so we're going to kill a whole society. We're going to destroy all the businesses to help prevent people from getting diseases.
I'm sure you have an opinion on the economic side as to what's behind that motivation. What is the benefit to someone, the elite class, whatever, in destroying the global economy?
It's the goal to make America a socialist communist country. That's what they want. The Democrats want that. They are gleeful. They want before this even came, they were hoping. I heard Bill Maher on TV saying, we need a good recession to get rid of. I don't care if the economy collapses, whatever we can to get rid of Trump. This is their great opportunity to get rid of Donald Trump.
But I don't know. I don't know about that. Trump's popularity has done pretty well under this. Of course, there are critics out there, but it's kind of like a wartime president. Wartime presidents are always popular. Are you kidding me? Look, I'm not even being political. I'm just being logical here. You think Joe Biden is going to beat Trump? Seriously, that's not.
God forbid.
Happen.
Well, sir, I don't even know Joe Biden is going to make it past the Democratic convention.
The guy's just incompetent. You can argue that Trump is too, but Biden, seriously, come on. And Bernie Sanders is a delusional man.
I know. But when you have 32% unemployment, sir, you have social upheaval.
Yeah,
sure. And when that happens, and this isn't going to bounce back. We've got to turn things around right now. So what I have done, let me get back. What people can do. First, you're in charge of your health, Jason. I'm in charge of mine. Everybody's in charge of their own health. The government's not in charge of your health. Your insurance company's not. Your doctor's not. Your employer's not in charge of your health. Your spouse not in charge of your health. You're in charge of your health. If you're unhealthy, shame on you. It's your fault. You can be healthy. You just got to make some life choice decisions. One, eat healthy. Eliminate your simple carbs. Cut way back on things that convert to sugar. That's all your simple carbohydrates and starches, corn, pizza, corn, potatoes, rice, and grain products. They all convert to sugar. Sugar depresses the immune system. It causes inflammation in the body. Cut that way back. Most Americans, that's all they eat, Let's have a donut what do you have for breakfast? Donuts, okay. Another donut at midday, on and on. And so they're carrying around, 70% of our listening audience right now is overweight, 35% are obese. Whose fault is that? Yep. Their own fault, your own fault. Sure. Get yourself down to an ideal body weight. Second thing is, get on vitamins and minerals to support your immune system. It's very clear. There's thousands of papers on the benefits of vitamins and minerals when it comes to the immune system. And I recommend A, B, C, D, and Z. How hard is that to forget? An alphabet. A, B, C, D, and Z. And you can throw in E if you want to. And so I recommend high dose of vitamin A, at least 10,000 if you're feeling well, 50,000 if you're not. International units, good B complex. Take vitamin C. I advocate and have always advocated 1,000 milligrams per 25 pounds of body weight because all the mammals
per 25 pounds. So in other words, a 150-pound person would be taking 6,000
milligrams.
Wow, that's oh my gosh. Okay, and do you take those all in one setting, or do you take them throughout the day?
Split them up at least in two. It'd be better if you take it in three. You want to kind of keep a constant dose of the vitamin C. And the reason I come up with that, let me tell you why I come up with that number. All the you may not know this. All mammals and all vertebrates make vitamin C, except for humans, monkeys, and guinea pigs. Mm-hmm. We don't make vitamin C. They make 1,000 milligrams per 25 pounds of body weight. When they get sick, they double the amount. So that's why I recommend it. I've taken 10,000 milligrams for 27 years, and then the last 3 years I take 20,000 milligrams a day. Mm-hmm. And that's when. So then you need to take vitamin D. Vitamin D, you need to take 5,000 to 10,000 international units. Inevitably, everybody we see in our office has low vitamin D levels. You need to get it above 70, closer to 100 PGs per ml. That would be a good range, and you'll do well on that. And then take zinc, 30 to 60 milligrams a day. And you take more if you get sick. I recommend 50,000 of vitamin D3. It's vitamin D3. That's the active vitamin D. You take that. Be sure to take vitamin D3, 50,000 milligrams for 4 or 5 days if you're getting sick. And then vitamin C, 2,000 milligrams every 2 hours till you get loose stools. And then take that and you'll do fine. Unless you have some, you're going to do fine. And that's all we have to offer. Most people just get over this stuff at home. Some, and of course, they do have hydroxychloroquine, and there's some, that's a key one. That's been very effective where it's been used. I support that. There's no reason in the world you shouldn't try it. And all these people say, well, we don't know if the trials are safe.
A friend of mine,
we know it's safe. We've used it for 60 years.
I've had a couple of friends who actually had coronavirus and were hospitalized. Right. And one of them, he was on one of our mastermind calls, and he said, I tell you, hydroxychloroquine unequivocally saved my life. It was my immune system was attacking my lungs, or, forgive me if I don't repeat that correctly exactly, but he said something to that effect. And as soon as the hydroxychloroquine started, he started getting well, and he was released from the hospital. So, yeah, interesting stuff. Stephen?
Let me mention one quick thing. One of the reasons we're not seeing everybody go back to work until we get a clear pass on this is because they're worried about plaintiff attorneys. If I were to hold my restaurant, people come in and they get the coronavirus, I could get sued. And that's the same thing with the churches. So nobody said anything about the plaintiff attorneys, but everybody's worried about lawsuits. If anybody wants further information about not only the coronavirus, but natural approaches to health, go to my Facebook page, which is Hotze, Hotze Health. Now, if anybody wants vitamins, I've got a vitamin store. And you can maybe get them in your local shop, A, B, C, D, and Z. If you want to remember what dose, go to Hotze Vitamins, Hotze Vitamins. And I have, guess what, a Dr. Hotze Immune Pack. Hello. I want to help you and help your guests and your listening audience stay healthy and well. And it's not something you take in a crisis. It's something you take every day, all your life, so you're ready for the attack. When you are attacked, your body's healthy and your immune system healthy. And remember this, everybody comes in contact with trillions of viruses and bacteria every day. I hate to say that for all the germaphobes. It probably makes them squirmish, but that's just the case. And we have an immune system God's given us to help us fight this off. And one last thing, Jason, remind your audience, for those of us that are Christians and believe in the Bible, there's a verse in Scripture that said God has not given us a spirit of fear, but of power and love and a sound mind. Think logically. Don't be scared. Trust God. Keep yourself in good health by eating healthy, taking your vitamins and minerals, getting a good night's sleep, and exercising, and you'll be fine.
Stephen, thanks for joining us.
My pleasure, and God bless you, sir.
Thank you so much for listening. Please be sure to subscribe so that you don't miss any episodes. Be sure to check out the show's specific website and our general website, hartmanmedia.com, for appropriate disclaimers and terms of service. Remember that guest opinions are their own, and if you require specific legal or tax advice or advice in any other specialized area, please consult an appropriate professional. And we also very much appreciate you reviewing the show. Please please go to iTunes or Stitcher Radio or whatever platform you're using and write a review for the show. We would very much appreciate that. And be sure to make it official and subscribe so you do not miss any episodes. We look forward to seeing you on the next episode.